what do you know about pain? So I don't repeat. I will try to make learning kind of basic today, the learning about the scientific part of pain or pain mechanism, because I don't want to make it more painful, right? So I will try to avoid the neuroscience and psychology jargon and talk about pain in a language that is familiar to everyone. Today, let's explore what pain is in our daily experience, either what we know about ourselves or what we know from people that we treat, help, or encounter. What do you think about pain? Anyone?
I'm going to say something, Aneta.
Yes, please.
It's subjective.
How did you guess that?
My version of pain is different from your version of pain.
And how do we know that? How do you know that?
Because if I talked about my headache now and somebody else had a headache, I'm sure we'd have a vastly different subjective view on it.
Right. Okay. Anyone else? Yeah. What do you think pain is? How do you know you're in pain? Is telling us it's an indicator of something that needs our attention and warning. Okay.
It's both. It's a physical as well as an emotional experience.
Yes, brilliant. Great. And nobody says it's unpleasant experience. So I think we all agree on that. And we don't think about it because we think it's something much more. But according to a definition that I would like to present to you today, and I think it's a brilliant definition that encompasses all what was said by Tricia, but Gwen, and probably what we actually instinctively know, but it was put together very nicely by the Association for the Study of Pain, which is the world's top research organization made of over 7,000 researchers from nearly every country on the globe. And that association produces a definition which states that pain is unpleasant, sensory and emotional experience associated with actual or potential tissue damage, or described in terms of such damage. Importantly, the researchers also added that the inability to communicate verbally doesn't negate the possibility that an individual is experiencing pain and is in need of appropriate pain relief treatment. I think that it's really a brilliant framework and tells us all we know about pain, either from the scientific point of view or from our own experience. It's unpleasant, right? We agree on that. There is no need for me to explain that element of pain. We want to get rid of it, probably. Who wants to get rid of it? Forever? Yes, I want it as well. I did change my mind. Maybe you will change it as well. So, of course, unfortunately, it stays, right? It stays. As we learn about the mechanism, we will maybe learn to appreciate its value in some instances. But because it stays, let's look at the components and how it's made. So we have this sensory and emotional experience, okay? And it can be associated with actual damage to our body, or it signals a potential damage, which is also interesting, right? So not always when we hurt, we have damage in our body, which to some people is news. It was news for me. I thought if I hurt that there must be something wrong in my body and, I have to seek medical attention and fix it. So not always. But obviously we know, and it's easy to understand the pain that is associated with the tissue damage. And that's where the sensory pathways play a role for communicating it to us. So you probably also understand that sensory means to have something to do with our senses. And you know very well your 5 basic senses: touch, smell, vision, hearing, etc. And pain is somehow debated. It should be our sense, or it should be not. Should be considered as a sense, as something that, it's one of the basic senses, or it is not. So researchers can't really agree on that. They're still quarreling. But to make it easy, I can tell you about the components that are similar in a pain perception to any other perception you know. So you know that to see, we need a process of stimulus. So there is something to see, and it's made visible by light hitting that surface, right, the corners and so on. And once the light hits our retina, we have on eyes receptors that will translate the signal into a electrical potential, which is a language that our nerve system operates on or understands. Once this is translated and it's received in the brain from periphery of our nervous system, then the brain's interpretation of what's happening and help us assess the situation and possibly take an action, right? So you've got this sensory component of the pain, which is similar to all the senses, by the way, that it's got its own receptors. So pain receptors are located in our body, all over our skin, but also internally in the tissues, organs, next to the organs, especially in the muscles, in joints. But we have plenty of those just to signal us of any potential damaging stimulus, right? So we have the sensors. Once the sensor, the end of nerves, we call it, so you can imagine that you pin with some sharp object your finger. Oh, it hurts, and it hurts a lot. And that means that the message was received by the endings of the nerves, which are equipped with receptors. And for pain, we call these receptors nociceptors. So, and the nociceptor will signal to the nerve that is, attached to or it's next to, that there is something wrong, gets excited, so-called, and it starts screaming, through the structures that it possesses, through its axons and dendrites, you probably heard that, and passes the message to the more specialized command centers, and which we can call nerve fibers. So receptors, then nerve fibers will travel from my finger, through my arm, straight to the spine. It's pretty forward process, about 3 steps process, right? Stimuli, sensory activation, which means nociceptor recognize there is something wrong, there's something painful in that case, transfers the signal to a spine cord, and then it goes to the brain. And that's the kind of neuropath that all the sensations follow. So that's why we say pain is a sensation, because it's got its own receptors and its own neural pathways. What do we have then? We have the component of feelings. And as you could probably catch me saying the signal is passed to the brain, you could then think that this gets complicated, and that's where our sensation of emotions arise, right? Where emotions arise, where things are assessed by a brain. So there is no feeling of pain without the brain. There is a sensation that for us to perceive as painful, we need activation of certain parts of the brain that are responsible for telling us and our consciousness that there is something wrong. So from that, you can see that there could be a pain without sensation, right? Because just my brain can decide something is hurtful because it's on the top of decision. And there also could be a pain that we do not perceive as painful because our brain could be either busy somewhere else or decides this is not important. And there comes the important discovery with that, right? Because once you realize the brain plays a final and very active role in deciding for your painful experience, what is painful experience, what isn't, then you can think about, that influencing any processes in brain, well, not any, but the processes that contribute to the experience of brain, you can then influence the perception, the intensity, the experience of feeling the pain. Does that make sense? Okay, so
Aneta, we have a question from Satish.
Yeah.
Who do not nausea uniquely process pain or any other signals too. I haven't pronounced that correctly.
Yes, receptors, they do uniquely process pain. That's why we can say pain is a sensory perception equipped with its own pathways and receptors for recognizing what's painful. Those nociceptors are, we guess that they broadly specialize in thermal, right, pain, pressure pain, or chemical pain. Okay, so what follows is we receive a stimulation through the other senses, and then we may feel very overwhelmed and very bad about it, but this is processed separately from the pain paths, if you like. Of course, any other perception also is evaluated in the brain, and we always add this emotional component and value if it's nice or not nice, right? Like touch. We evaluate if the touch is something that we like or not like. But touch, until it becomes pain, is perceived as something, let's say, neutral, a sensation. It only starts being a pain if the pressure, you can imagine, to the hand or to another part of the body becomes too high, too strong. And that's the role of nociceptors to notice that or not and pass the signal. The pressure is too high. It's not touch anymore. It's pain. So that's why.
Kimmy's made an interesting comment. The narrative of pain is complex in terms of the pain response indicating tissue damage, etc. Can actually be a precursor to adaptation and physical or mental supercompensation. Very tricky then, because this pain actually becomes the vehicle to progress and change for the better. A balancing act.
Yes, we talk about it. That's absolutely super correct and beautifully put. And we talk about it a bit later if time allows. I love that. It's much deeper. I'm just trying to concentrate on showing you the mechanics of pain, if you like, okay, how it goes. So if you think that peripheral nervous system is involved first in perceiving pain associated with outside stimuli, or inside stimuli as well, if there's any damage to our body internally, then we can comprehend the steps of treatments that we can apply. So we know that the experience gets transmitted as a sensation through the nerves. So one way of blocking pain would be to block the sensations or the activation in this nerve. And that's what, for example, anesthesia does to you, right? And thanks to that kind of mechanism, blocking the nerves, for example, that are ending in your root canals, in your teeth, when you go to the dentist, gives you relief from pain. You block the excitation of these neurons. They are not able to send a signal forward. It's pain. So we have this component of sensory unpleasant feeling that then it goes to the brain. And that's what I said, gets complicated quite a bit. And that's where this comment, has got a huge validity that you just read, Trish. So in the brain, we have so-called signature of pain. So now neuroscientific research and neuroimaging techniques allow us to actually see activation of the brain during painful experience. Therefore, we no longer doubt a person who says is in pain, because by correlation of observing certain areas of the brain, we are convinced or we believe that this is a painful experience. And that was done obviously by examining quite a big amount of people in pain. And we know that during a painful experience, there are 4 areas of the brain that activated. And that's important because, again, we can think about psychological treatment, right? Not only pharmacological. And those areas are sensory cortex first, right? So you've got this part of the brain that is like a band between your ears, just off the center. In that sensory cortex, the signal arrives and it tells you the location. Where is it? You know, that's why we know with exact precision where that pin got us. There we have the limbic system, when it's very heavily involved in processing what's happening. It really makes us, you know, feel the unpleasantness of that experience. So therefore we move ourselves and do something about it. I guess everyone here knows what I mean. Pain is a greater motivator emotionally. Attention, emotionally tells us this is really bad, and we may even, have a big consequences if we don't do something about it. And this emotional appraisal, if you like, of this, how this part of the brain assess the pain, it differs between people, right? We know because limbic system consists of amygdala and hippocampus, that are different by experience, by traumas that we have been living, by memories that we are holding. So this is the part which will tell us the value of that pain for us personally. And there another part of the brain which is heavily involved in pain experience is the prefrontal cortex. So it's the place where we think. It's the place where we're going to assess the context of that pain, okay? It's the place where we're going to assess, is it, useful? What does it give us? How it fits with our goals and so on. And finally, you will have a motor cortex, which when all the other centers agree, there is action needed, the impulse is sent. Some of those impulses in motor withdrawal from the noxious stimuli are automatic, so we don't go through the brain, like the reflex of taking your hand from the fire. We can't afford, sitting around and thinking it's good or not. Still, there are some reflexes that do not pass by the brain and cause immediate motor reaction. But most of the other pain experiences are going through the brain, and the brain has to decide on sending a message to motor neurons to do something about it. That's why we clench our fists, grimace our face, all these physical expressions of pain, right, that follow after. So we have the emotional, and we show that we are in pain. And pain is quite difficult to fake. If you want to ever check, it's easy to fall because of our empathetic responses, but actually it's quite easy to spot someone who is faking pain because the way they open their mouth, it's very exaggerated and too regular and too often. That's a tip, because there are people who are trying to exaggerate pain for personal gains. So there we are, knowing that this pain processing takes place in a peripheral system, which we don't really control much. All of us, every one of us, every living organism, not only humans, right? All animals feel pain, but they don't perceive pain. I mean, feel in this instant means they registering the pain. The system register, either nervous system or specialized cells register. There is a stimuli in the environment that therefore I feel pain, therefore I withdraw, I react, I protect myself, right? But how we experience pain, like we humans, we have all these additional levels of processing pain and giving it a meaning, intensity, and therefore a different personalized, as you said, Tricia, sensory element to each experience of pain. So that's most of the definition, except the last one, and that's again tidying up nicely to that lovely quote from the chat. This kind of mechanism of pain has been developed by nature, or has evolved, if you like, to signal us a danger, right? That's the pain signaling danger and protecting us. So it's a protective function of our sensory pathways and our nervous system. bang in action, you know. It probably is the best example for me about the connection to body, mind, and environment, right? There's nothing like pain that brings us back to our body and puts our attention into what is hurting us, like what is around us that can hurt us. So that's the biggest part of the definition I think I explained to you. And the last thing is that it can signal either real damage that already occurred, so injury, or potential damage. And that's something that we can again talk about. So something new and added quite recently to the definition because of the way that we theorize in neuroscience that our brain works. Our brain works in a predictive manner. So even if it's got enough data derived from either environment, our past experience, or what's happening around us and inside us about danger, it prefers to signal danger before it happens, right? So that's one part of sometimes pain coming before actually the tissue is damaged. And you probably know that if you try to run a marathon, right? The running will put you in pain much earlier than actually there is any damage. I mean, a lot of running. But the point is that you're in pain before actually there is any damage to your tissues, just to signal you that. And for me, it will be 20 minutes. And we do succumb to that message. We do try to respond. Most of the time, it's inevitable to respond and to meet the painful experience. Any question in the state? There's so much to talk about. I'm sorry.
We've got a few on the chat. Or please just come off mute and ask your question.
Yes, that'll be easier because it's difficult for me to read the chat.
If we don't have anyone, we have another question from Satish. When you were talking about pain perception and blocking, is that the same mechanism? Hypnosis blocks pain too, at least when done correctly.
Yes, so once you know that there are these elements of pain either in the peripheral system that we cannot control consciously ever, anything before our brain, there is nothing much we can do except to trust our bodies that they do the right job of spotting danger and injury and repairing it. So we have to be patient with some of these pains that are so-called acute pain and good pain, signaling injury or potential injury. But then because we have the signal, or when the signal is passed to the brain, not always, right? Sometimes our peripheral system deals with it quite efficiently. And all the mechanisms, how the signal is passed and modulated on the way, is also a talk for another time, after we know a bit today. So when it comes to the brain, and then when you understand that the brain has so much to say about experiencing pain or not experiencing, about intensity of this pain that you're feeling and the actions you may take and so on, then you may start to understand that, yes, hypnosis may help. Basically anything that touches and modulates our emotions and thoughts, because the emotional limbic system and prefrontal cortex are involved. Anything that kind of touches our cognition or modulates it, which can improve, if you like, control of pain, right? Of intensity of pain, can modulate the experience of pain. So yes, we can talk about different treatments. Hypnosis is absolutely one of those. The mechanism by what it works, again, we can talk about it later. Any cognitive behavioral therapy also has been proven useful in reframing the brain, in how we put attention to our brain. The way that our prefrontal cortex influence the pain are in three main ways. So it's the prediction that I already kind of mentioned, is the attention it decides to put on the event, or what else? It's emotions, right? So it's like interaction with these emotions when it judges it, if it's worth to listen to our limbic system or not, right? So if you can influence tension, and parents here probably know that when your child has a little scratched knee, mommy tries to take his attention to the singing bird, and this pain, it becomes lighter or even disappears. So where you put your attention, if you put your attention on pain, it will magnify the feeling of it, right? If you emotionally are afraid of it and think about this negative consequences then it brings and expect the negativity of the pain, either physically or influencing your life in the longer term, then again, it magnifies our perception of pain. So just to touch on this.
We've got a couple of hands up. Gwen,
Yes.
Saskia.
Yeah, just wanted to say, so you covered a lot of the acute pain, but then on the other hand, obviously there's chronic pain, which is a whole kind of disease in itself, and where we see a high share of population suffering from chronic pain, and where treatments, then you see a lot of like multimodal treatments and people from different areas working together. So perhaps you can cover that a little bit.
Yes, sure, absolutely. Yes, so I wanted to actually continue that you're right. I covered the basic mechanism of pain, how the pain happens to be in our consciousness, what causes it to arrive to our conscious experience, to have a conscious experience of pain, and how at the different stages we can, have a modality that will control the intensity, for example, of pain, or eliminate it, right? Anesthesia or by different treatments that address processes in the brain. That kind of pain that, let's say, we can connect with a stimuli or damage, it's called nociceptive pain. Okay, it's a pain that is acute, usually doesn't last too long, is associated with injury, and it should pass when the injury is healed and the danger is not longer there. But pain comes in 4 different flavors. So apart from this nociceptive type of pain, acute pain, we have pain which is called inflammatory pain, and you can guess it arises in connection with immune system producing chemical substances that amplify pain in the nervous system. So if you have inflammation next to injury or without injury, there are immune cells that produce something which is called cytokines. And those, you can say, signal the neurons to amplify the signal something is wrong. So not only nerve system then is screaming there's something wrong because you have a broken leg, but now the immune cells sending their own voice and amplify all this, saying this is really bad. And until inflammation comes down, we have normally the biggest kind of period of pain associated with injury, right? And then we have the dysfunctional pain, the pain that neither inflammation or injury can be detected. And that you probably heard of: fibromyalgia, migraines, irritable bowel syndromes on top of my head. And those are really difficult pains to untangle, because as in nociceptive pain, we can treat the injury and then hope that the pain will diminish and go away once we healed. When inflammation, we can similarly try to address the inflammation with a treatment. With dysfunctional pain, we have very little to offer on the basis of the sensory, if you like, mechanism, right? We don't see inflammation, so we can't treat it, and we don't see any damage in the tissue. However, people suffer with this type of pain. And the last one, probably the worst type of pain, we have the neuropathic pain which occurs when there is a damage to the nervous system. So you probably heard at least that when someone suffers of neuropathic pain, it is because there was a damage caused to the nerves or nervous system, and we presume that it changed the whole way the nervous system works. So this happens in times of trauma, as you can think about surgeries. We can have a surgery to save some parts of our system, but unfortunately some nerves have been cut or damaged on the way. And then we have this post-operatory neuropathic pain. It can happen because of the pressure on the nerves, and you probably heard that as well, when the herniated disc in neck or in the back pain, lower back presses on the nerve itself, on the nerve cell itself. That can also happen because of the neuroviruses, and there are other instances. So neuropathic pain can be very persistent and could be looked at as a chronic pain, but not always, right? Not always. So coming to the thing that Saskia mentioned, what is chronic pain? I agree absolutely with you, and it's agreed that chronic pain is not just the acute first pain turned on forever or hasn't stopped. Chronic pain is when the injury is gone, operation is done, everything is healed, but it persists. It persists over 3 or more months after presumed healing took place. And chronic pain is disease in itself, as Saskia said, because brain on pain changes itself. So we hypothesize that it's due to neuroplasticity, right? That the firing of the nervous system, there are a few kind of hypotheses I can talk about in a minute, but we hypothesize that nervous system basically get out of whack now and is reacting in amplifying pain instead of helping us to modulate it as it normally does, right? Acute pain, the worst is the first hit, and then it kind of wears down. So what to say about chronic pain? Wow, it's, as Saskia said, it's an awful and complex problem, which is totally under-researched and totally unresolved, and it's a massive problem because, according to various reports, about 40% of people today live with a chronic pain. And these reports, funny enough, do not include children, people in the nursing homes, people at the end of the care, and military personnel. So you can possibly see how inaccurate that 40% or how low then in reality the amount of people living with pain today is. And we have very little to offer in terms of chronic pain, because you probably all know here that our medical system is a system that treats injuries, visible injuries. And to make matter worse, and that's why I think it's so worth it that we here learn about pain and how to manage it by ourselves. What's so shocking, apart from doctors who specialize in pain management, your average doctor or average specialist will not know much about pain. The reports done in the United States, but by Stanford and Hopkins universities and by KCL in London actually, tell us that medical students over their whole education receive between 9 to 12 hours of teaching about pain. And the education about pain is not implemented in medical school to the extent we would like. And by comparison, if you're a veterinary student, you will receive about 90 hours about pain. So maybe sometimes better to talk to a vet or physiotherapist. But you have to be aware that the doctors that supposed to help us with pain are very limited in prescription, because you probably heard about opioid epidemics, which is not good news for people who need painkillers, because opioids do work in pains, but the regulation on opioids prescription is very much more severe, if you like, in many countries that it requires. So there you go. We have this epidemic, as Saskia said, of people suffering in pain all over the world, and we don't have much to offer. And there are no medical personnel that can actually, apart from few specialized places, that can offer us guidance on how to deal with chronic pain. Anything else that I can add? If you like to know what contributes to development of chronic pain? It's always the same mechanism. Research shows that people, for example, with a chronic back pain, so much more activation in emotional centers of the brain than those who are just experiencing acute moment of pain, if you like. So we think and we know that as you said, Saskia, disciplinary treatments, like many things are needed to modulate the chronic pain and help a person to get out of it even. That's also quite possible.
Aneta, there is one question here from Catherine Harris. Do you study the role of poor nutrition choices in inflammatory pain? From an integrated medical approach, this can make a huge difference from my experience. And it fits with the minimal teaching on pain in medics. And she's put addiction as well to painkillers and how big.
Yeah.
How big.
Oh yes, and to add to the also tragic of minimal teaching on nutrition and any other lifestyle modifications, right? In medical schools, we know that it's very similar. I think medical students in US will receive about, if I'm not mistaken, 6 hours of tuition on a nutrition, and it's influencing how we basically live. So yes, absolutely. I don't have time, I'm afraid, to go into inflammation because we're one huge, massive topic. Today, I just wanted to signal that inflammation causes pain, and there is pathways that are different than pathways of sensory experiencing. So that's Catherine, I'm so sorry. We can absolutely connect and talk about what causes inflammation and how to stop it and what modifies it. And you're absolutely right. And that what we put in our bodies absolutely gets a response from our organs and systems, right? So this is a big and wide topic to talk about, to discuss, and maybe I could share some research on that, surely.
We have another question from Margot, which is, how does chronic stress, for example, lead to pain like migraines? Is that linked? I.e., assist yourself to be aware of your mental state.
Wow, yeah, migraines, right? Where to start? I was just attending a conference last week on vestibular disorders, which migraine is. We consider one of it. We don't know much about migraine, unfortunately. Again, in lines with so little money is spent on research into pain, and migraines manifest basically as a pain, right? There are not many migraines that are associated in a signature of inflammation or damage to the body. So it's difficult to get to know where it comes from. And all the patients or people who do suffer from it make progress by observing their own body, right? The impulses that they receive from the outside world and how this makes them experience pain. So again, that's a huge topic. I can talk about it all the time. But it lends itself, bring pain, lends itself to the same modification mechanism. We would try to live as clean life, I guess, as possible, as also active, as healthy then for ourselves, and then observe if there are any additional things that will impact our headaches. And absolutely, stress has been linked to a feeling of pain, chronic pain, not only migraine. Like stress exacerbates the feelings of pain, and pain in itself is a stressor, right? So obviously, any treatment, if you like, or any modalities that will teach us to moderate stress in our lives, or the kind of, I always like to say stress is okay, but how do we moderate going back to the baseline, and how often we do that, right? So stress as an energy for acting is fine. We don't want to avoid it, but how do we calm ourselves? And do we really know how to calm our nervous system? So in that calm space, we experience the release of the chemicals that are either endorphins, serotonin, all the chemicals that makes us feel safe and calm, right? If you like. So yes, migraine is another topic, a few hours about it. We can talk, I can share some materials again. We don't know about the mechanism of it. There are different types of migraine in which, always there's some genetic component as to the pain itself, right? I can imagine there is a genetic component that makes us more susceptible to feel the high intensity or feel no pain, right? In the spectrum, pain is in the spectrum. And the genes and expression of genes also interact with the outside environment. Therefore, we have a big field to explore and to try to help ourselves in modulating the experience of pain. All the things that you have touched today and you probably have experienced.
Aneta, hi Aneta.
Hello, Daniel.
It's so nice to see you in person. We need to discuss a lot offline, by the way.
Yes.
Is it okay if I just may add interoception as a big piece to this as well? I had chronic pain for many, many years, and that's a long story. I tried everything, Eastern, Western, all the things. And then I became trained as a yoga therapist over 15 years ago. And actually that was how I healed myself. But so much of it comes down to nervous system, learning how to befriend it in a way, and really developing this internal sense of knowing your body's signals is what I've understood in working with my own clients, because it's amazing how many people are actually in pain and don't even know they're in pain. It's actually wild until they get into their bodies.
Totally, yes. Totally. Stress can, for example, coming back to stress can dampen our, at one side, it can, amplify our pain, but also some amount of stress can dampen our perception of pain. You probably can recall an example from your own life when you didn't notice that something happened to you because you were, doing something more important, like, your pain didn't matter that much because you were helping another person. You were sick as a mother and then the child was sicker, right? And you kind of forgot about your pain. And so, yes, I think you're absolutely right, Daniel. I also suffered from chronic pains, unexplainable ones. And I went to the doctor and I said, give me something, they have herniated disc, which is unbearable. They give you the painkiller, but because individual differences, again, it doesn't always work, even on the same for anesthesia, right? It could have side effects. It does have a side effects in the longer term. And longer, we mean sometimes more than 4 days. Opioids are, only effective up to 4 days and addictive from then onwards. So when I've discovered over 10 years that there is a very little that, I could be offered outside to treat my pain as it appears, then I understood that there is a longer process, however, to address the pain, to understand. But that longer process also opens many doors, right? As you were saying. So, and the one side I wanted today for you to know that pain is your friend, it could be your friend, and then empower you to think about it in a kind of blocks that you can modulate with your own agency by looking to implement multimodal therapies that will target your thoughts and emotions, or our thoughts and emotions, and then help us to dampen the pain, right? Psychological research demonstrates that thoughts and emotions can amplify or dampen the pain. And studies from neuroscience tell us that affective emotional component and sensory circuits are working in tandem to create that pain experience. So again, my point is today for you to remember that you have a lot of agency and you can, investigate the blocks of pain that possibly happens to you. Is it acute? Is it short? Is it longer? May it come from injury that I need to address? May it come from inflammation and then lifestyles and longer term improvements to how we treat our body will that inflammation and that pain that comes from, or is it unexplainable, which means that it could be something that I can modulate with my attitude towards it, with my emotions, with mindfulness, with acceptance, and so on. So that's my point. There is a lot, not to lose hope. And if one person can't help you, if your doctor, doesn't recognize your pain, you can show the definition that it should, because it is subjective experience. It's very difficult to transmit in verbal language, but it is very real. And the neuroscience tells us so, and pictures tell us so, pictures of the brain. So go there and tell the doctor to educate themselves if they will. If not, look for psychotherapists who specialize in pain treatments, look for physiotherapists. They usually are quite interested in helping you to address the pain and elevate, and yoga therapists like Danielle, and people who have maybe, discovered their own pain, put some protocols into tackling it, and then achieved improvements. Always good to learn. If you understand the process, right? So you won't be sold snake oil either.
Aneta, I think chiropractic and osteopathic care might be included there.
Definitely.
As well. Yeah. So we've got just 2 minutes left. And there's lots of new messages in the chat.
No pain, no brain. I love that.
So things like hormones, relationship with pain. One question, what methods are there for pain re-education? You mentioned CBT. Are there any other modalities in terms of neurological, neuropathic pain? Has made a point. So I don't know if you want to answer that question about modalities for pain re-education as a last point.
So yes, the modalities. So again, we understand now that the pain has this multimodal components, right? And knowing that, we know that we can treat it through accessing this components. So we can have pharmacological treatment, which is important as well to have, because I was led to believe erroneously before that pain is something that you suffer. Don't take painkillers because you can do it, you can go through this and so on. Unfortunately, that's a myth, and chronic pain do change brain to the extent of loss of gray matter. So that's one thing to be very prepared to treat your pain as it comes, and not to give in to the myth that it's a punishment or you have to suffer or so on. No, it is something that you can address, and it does damage your brain, as beautifully Caroline said. No pain, no brain. Pain, no brain as well. Less brain if there's too much pain. So do take some painkillers, especially the research is on that in the beginning when you have acute pain. So treat that pain so your nervous system do not get so-called oversensitive and overriding. So research shows that modulate the pain in the beginning makes the people suffer less. For example, people who receive before operation painkillers, and I can attest to that. My dentist was cutting my jaw. If I received the painkillers before the operation, my pain was less after, and it was more manageable, and it made me capable of putting all the modalities in place. Obviously, when it hurts, excuse my language, like hell, we're not able to project happy emotions. So do use painkillers if you need them. Do ask for them, because another problem in a medical establishment is, and unfortunately for us women, definitely, pain medication are not prescribed as often as they should. And women have to make 4 trips to the doctor before they receive adequate pain medication. Sad. While at the same time, within the 40% of population which suffers pain in the world, women are the majority. And someone mentioned hormones and so on. There are few theories about why we women are affected by pain, suffering more in the longer terms. One of it is related to the hormones. In men, it's theorized that testosterone actually diminish the pain signals in the nerves, right? Women have less testosterone and therefore more susceptibility to feel pain. And there is some research on top, not conclusive, that estrogen makes the pain more pronounced, so amplifies the signal, but it's unconclusive. Again, another talk, we can talk about it and we can theorize, but do be aware that sometimes you do have to be your own advocate, if not always, and do that. Get educated at the basics of pain, and do not be pushed away when you're suffering. If you have access to any, as someone says, unfortunately, too few places for pain therapy, yes, but you do find them. Fortunately, in UK and France and so on, do search for it. And so if you suffer with any chronic pain, I had a colleague who suffered from some issues in a urinary tract system, which, normally is treated only by antibiotics, but after 2 years, taking antibiotics and still feeling pain, finally some clever young doctor told her go to the pain clinic, where urologist was aware of treating the pain. And for example, in that instance, you can treat pain because someone's then asking what kind of medications we have. So apart from opioids, we also can use serotonergic medication, meds, to modulate the pain in a small quantities that don't affect our moods or brain processing, but affect somehow the passing of the signal of the pain. So there are options, again, pharmacologically, and then when we feel well enough to work on our pain psychologically and with other people and movement, right? Anti-inflammatory diet, as we mentioned, and looking for joyful experiences that will send and contradict the signal of pain to our brain. That also another type of research that says people who are more optimistic, more have more hobbies, more things to be joyful with, they and we can create that, right, consciously, right? If we don't have it today, we can strive for that and treat it as a pain medicine.
Thank you. That was very, very insightful, and it's very unfamiliar to me. However, I've been working in sports for a long time, so your analogy there about try and encounter that beast as little as possible, it's almost an inevitable aspect of sporting endeavors, really, is that pain element. So it's almost understanding how do you tame that beast rather than avoid it entirely. So that's the bit that really fascinates me, and is probably where I'll spend more time looking in the future, is around understanding the bandwidth of the individuality of pain, and how do you not diminish it, because you want to still respect the fact that that signal is indicating something. But if you can diminish it, fantastic, because there will be an inevitable, I don't know, your insight on this would be very useful about, is it something that you become familiar with and the body attunes itself to over time?
Where to start with this? It's so fascinating. You're absolutely right. We have at one side people who desperately want to get rid of pain, and others who put themselves in pain, right? Because of some goals that they want to achieve. And I always marvel how boxing is possible. How can you endure something like that, right? So absolutely, it must be very different kind of perspective you're coming from by the ways that you work and encounter pain and what you want to do with it, right? So I think it's still valid in any community, in any person's life, that we want to control the pain, right? We want to control it, and as you said, will not want to go to the limits, right? So we don't want to break our body. We want to be conscious. And Danielle mentioned interoceptions. How do we learn about signals from the body? I don't know if you practice that, and with your sport people, it's something that teaches through mindfulness awareness, if you like. We can acquire knowledge about body language, if you like, okay, that are not only on black and white spectrum. I have pain or I don't. It's too late when I do, and when I don't, I do whatever my brain, comes up with, right? Jumping too fast, too high, and doing things that I shouldn't be doing. But so that's the thing. This is a spectrum of pain, and we want to be aware of that spectrum, and it's possible to learn this, I think. And that's another very sad story, that we don't learn about our bodies. So not knowing the mechanism, I obviously don't know what I broke, if I broke, right? And therefore I become afraid as well, right? Pain means that I'm always broken. And as today I was trying to say, sometimes there is pain and there is no damage. So knowing about the mechanisms, again, for me, has been very important, because then I can, look at each of them and see how useful the function of this mechanism is for my goals. So sometimes the pain will be useful because it will tell me to do something, and I should definitely not ignore it. And sometimes I want to, if you like, increase tolerance to that pain, right? Either because there is no painkillers or, a way to get out of it right now, or because feeling that pain stops me achieving my goals, right? And we humans are quite incredibly versed into training ourselves out of pain. A young child told me, she said, "Oh, I know about, how to stop pain. I go to karate classes and my teacher tells me, take a stick and rub it on your shin." It's like, wow, that's painful. Yes, but you killed the nerve cells. After I, was talking about pain to them, I said, "Wow, how do you know kill the cells?" She said, "No, he didn't say that. I now think that's what happens." You can desensitize them. There is, a bit more to it, but yes. So you will have practices that could influence, or you will develop practices in your, in your area probably, and your sport that could influence the intensity of the sensory stimulation, if you like. So on that level, right? And that could be achieved exactly by desensitizing neurons, right? But also in that field, I think you may like to investigate, Kimi, there are quite a large genetic differences. That's why some of us never will be running marathons, because the pain is not worth it. So one of the ways that gene play quite significant role, I don't know if you've heard, there are people who feel no pain, very few, but they feel no physical suffering. And on the same spectrum, with the same mutation, there are people who have a disease called man of fire. Any stimuli coming in contact with them cause them excruciating pain. And that is caused by a gene mutation that controls sodium channels. Tell me if it's too technical. Sodium channels need to open and close in the nerve cells to allow the signal to be propagated, to be felt. So that's how anesthesia works. We block these channels, no pain, right? The problem is that there are about 9 sodium channels known by now. We thought it was 1, right? That would be easy, bang, we block it. And that's the problem with anesthesia. You cannot block too much of them, not for too long. An anesthesiologist watches carefully the doses of anesthesia, because if it's too much, you may stop breathing. There'll be no signal passing in the crucial areas of the brain because you've closed sodium channels. So you have these people who feel no pain. I think there are 30 of them in the world recently known about it, because if you don't know that pain exists, sometimes you don't think about it, you don't know. So it's quite recent kind of discovery that there are people who do not feel pain. But those people do not live happy life. There is a family in UK that had 3 children with this genetic mutation. 2 of those children die in a very young age because they didn't cry when there was infection. Infection spreads, we don't know anything about it. Another girl died of this family when she was about, I think, 4 or 6, because of the damage she had encountered by basically touching things that we would never touch. Fires, sharp objects jumping from the too high things, or even, rolling down the stairs, because it doesn't hurt. We don't know. Breakage is there, damage is done, body cannot cope, right? And the oldest child, still living, the boy is in early 20s, and he is heavily disfigured, and he is in a hospital on a regular basis because he doesn't know that the blisters due to shoes have turned into a terrible infection, and so on. So we mustn't wish for no pain, right? If anyone wants, tell them to go and check that this life is not really a good life to live. But then we also don't want too much pain. And coming back to your people, you may investigate, or we may be able to investigate soon, for example, these mutations in people that will tell us that, because it's on a spectrum between nothing and the people still experience less susceptibility to a pain, which may be due to the certain mutation, because there are people, again, with mutation in that sodium channels, which says the pain is terrible and you can't take it. But then another mutation comes online for another channel that opens super fast, and modulates this pain. So that person supposedly should be feeling man on fire symptoms, but she doesn't. So it will be so interesting to see, and I guess there would be some research about the natural or genetic predisposition to pain and association of a person wanted to do sports, right? So
That's
again,
fascinating. Thank you, Anita.
right?
Because as you were mentioning and talking about that family, and pain is a big part of the learning process. I think ultimately you have to experience pain at some point in the scale to learn what is good, what is bad, what can't you touch, etc. So understanding that there's a massive genetic component makes a lot of sense. But I suppose in terms of the things that we can affect, and you see this a lot in people who have experienced trauma or hardship and troubled times that have an emotional, and I think another participant has talked about this, that's probably something that we can influence a little bit more aside away from genetics is the way that we perceive, or how do we kind of look at the narrative around what we have experienced and what we've been subjected to. So I also am fascinated about the relationship between pain and trauma and how we understand that.
Oh, totally. Reach out to me, because that's fascinating, and I guess Tricia as well had something to say on add to this. Basically, this meaning of pain is you can call it, right, is what our prefrontal cortex produces in connection with the limbic system, the emotional input. So as I mentioned, there is an amygdala and hippocampus which play a big role in modulate this meaning, and also the memories and the social context, right? So memories of trauma, as you said, and socially, there are some practices that are very painful and accepted because they form a part of rituals and so on. Or like you said, in sport, it's kind of okay to hurt, it's normal, and, it's much more, it's differently portrayed. Or in a labor, on a scale of pain that human can actually consciously, take on, is the highest, is 56 on a scale of 60. After 56, you basically pass out. But women go through not one in life, right? Because the meaning of that pain and the reward, is something that makes you kind of integrate that pain as something important and useful. And possibly sport is the same. The medal, the limitations that you have overcome and not broke yourself, depends on who you're talking about. So again, it's important to know the limits, and to know that before the limits, there is quite a big margin so that you can push the limitations of our bodies that are impacted on us, on our psyche and our muscles. Because you probably know that the signal we get that our muscles are hurting is much more before, to stop the pain of muscle, for example, when we exercise or when we walk and so on, is much more before actually the real damage to the muscle, right? So, and that, I think, it's a big part in sport philosophy and even, in teaching children and young people, that there is a big margin. You're not broken yet just before you feel an ache in your leg. You can still go on. I walk in the mountains and I often say, no, 40 kilometers ahead, still you'll be not broken. You have enough power, but it's your brain, because you're not used to, because, it's new. And that comes from that prediction I was saying, a theory that it wants also to protect us from a possible damage. And that's, I think, for smart sports people, a brilliant field that they're experimenting with. And then you have probably, a lot to say about it. A lot of practices can do that for us. Don't know if that makes sense. And you're observing that, right? So,
yeah, I'll reach out. So thank you so much.
So we can tell, I remember always, that was a big revelation for me to let myself know that what my brain says is dangerous. It's not necessarily so. But the signal, yes, is important, and notice, and then you can go into next gear and say okay, how much do I still have? The reserves for walking, for this, so you don't panic, because again, you stress, you panic, you're in the middle of the mountains. Wow, that is a horrific experience which will stop you forever to experience life. Fascinating. Do reach out. I have a few amazing research and books on sports athletes and all these interventions. If you was a few years ago, I've collected. So glad to share. Thank you again, everyone, and hopefully we meet again.